Healed.
It healed. Okay. Even structurally.
And about this ligament tear, one more patient was there. She had visited. She is from Mysore only. She had visited my clinic for 1 week. She used to tell, when I walk on uneven surface, it hurts very badly. Very badly. So she came, I did same, Kshipra and Janu points and Agni Karma. And that day Udupi is famous for beach. So she went to beach. Beach, sand is there, uneven surface. That day she didn't feel pain. I can't tell it is healed, but pain she didn't feel. She got that confidence. She comes, once a while she comes to my clinic.
So in Shwasa, points you told like for
Just a request, can you please introduce yourself when you are asking questions so that we also come to know from which different area you are coming here.
Okay. So I am Dr. Anusha and I have my clinic in Madikeri. So my question is like you told the points for Shwasa, 4 angula above and below the medial part. So adu kapha ಮತ್ತೆ vata conditions ಅಲ್ಲಿ different ಆಗುತ್ತೆ because I did on 2 people. One was with full of cough and she got immediate relief. And vata ಇರೋರಿಗೆ they didn't find any like.
What was the sequence?
I did above first, then below.
So usually, I'll tell you. Last time I don't remember if I told sequence ಹೇಳಿಲ್ಲ. So when there is kapha, even in Gridrasi I'm telling. So if there is kapha vata predominance, you take upper point first,
Okay.
then lower point.
But how? That ಏನು reason ಏನು first?
Reason it is seen in practice.
Okay.
Usually kapha, pitta, vata.
Okay.
ಹಾಗೆ ತಗೊಂಡ್ರೆ ಯೂಶುವಲಿ ನಾರ್ಮಲ್ ಲಾಜಿಕ್ ವಿ ಆರ್ ಟೆಲಿಂಗ್. ಸೊ ಫಸ್ಟ್ ವೆನ್ ವಿ ಟೇಕ್ ಅಬವ್ ಪಾಯಿಂಟ್ ಆ್ಯಂಡ್ ದೆನ್ ಬಿಲೋ ಪಾಯಿಂಟ್, ಈವನ್ ಇನ್ ಗೃದ್ರಸಿ ವೇರ್ ದರ್ ಇಸ್ ಸ್ಟಿಫ್ನೆಸ್, ಸೊ ಇಟ್ ಈಸ್ ಕಫ ವಾತಜ ಗೃದ್ರಸಿ. ವಿ ಟೇಕ್ ಅಬವ್ ಪಾಯಿಂಟ್ ಫಸ್ಟ್, ಲೋವರ್ ಪಾಯಿಂಟ್ ನೆಕ್ಸ್ಟ್. ಸೊ ದೆನ್ ವಿ ವಿಲ್ ಗೆಟ್, ಯು ಟ್ರೈ ಇಟ್. And did you take this point?
Yes.
Okay.
That was done. And one more was a confusion with the Shota. Is it medial or lateral?
Lateral.
Lateral. Okay.
And one more thing, if Shwasa is not going with this with also, Karana Vedana can be done.
Okay. Which one?
In Maharashtra, Big Bali anta ಹೇಳ್ತಾರೆ, ಇಲ್ಲಿ ಹಾಕ್ತಾರೆ ನೋಡಿ. So same point, you just take a torch and you will feel that there is no circulation in particular area. That you prick it and leave it, put a thread and leave it. After some day, if you can put a ring in that area, ear also it is there, but it will work.
Complete prick mark.
Yes, ear piercing.
Ear piercing.
Take a suturing needle, small suturing needle. Suture, it's like prick it and take a needle out of it and tie it ashte.
Okay. Both the side or one?
One side.
ಯಾವ side ಅಂತ?
Right side ಅಲ್ಲಿ usually ಮಾಡ್ತಾರೆ.
Okay. Thank you, sir.
Sir, the refractive errors only ಯಾವ points and take result.
Same refractive errors we should first categorize. Patalagata roga. Same. And again we have to do it repeatedly.
ಯಾವ
Atandrita. And apart from that, if you want to give Kriya Kalpa or any other Panchakarma, you can give. You will get much more faster results.
Sir, I am Dr. Anand from Harihar. So, very basic question. I have a confusion.
Anand, just a second. Many two-wheelers have parked just in front of the hall. Now there is a procession. So those who have parked your two-wheelers here, can you please make that area free? You can park in the main road. So anyone has parked your two-wheelers just in front of this hall. 7099 EL 7099 two-wheeler number 7099. Okay, Anand.
Sir, is there any difference between Sira Vedha and Viddha Karma?
Yes, Siraveda, we expect blood to come out.
Yes.
And from prominent vein, we do the mokshana. But in that big shloka which I displayed over there, there are certain places where we won't find siras at all, like in Apanga region, in Kapala region. Kapala sometimes we find also, in Upanasika region. Where is the siras? So they have told in previous shloka I had shown Mamsaleshu something is there. In 8th chapter only it is there. So wherever you don't find Shira, they tell so much deep needle should be pricked in that particular area only. If you find Shira and if the patient is eligible for Rakta Mokshana, you do it.
Okay. The same thing. That initially,
Huh.
ಅವೇದ್ಯಾಹ ಇದರಲ್ಲಿ
Huh.
ಅದೃಷ್ಟಾಹ ಶಿರಾಹ ಅಂತಲೂ ಹೇಳಿದ್ದಾರೆ.
Huh.
ಮತ್ತೆ ಅಯಂತ್ರಿತಾಹ ದೃಷ್ಟಾಹ ಅಯಂತ್ರಿತಾಹ ಶಿರಾನು ಅಂತಲೂ ಹೇಳಿದ್ದಾರೆ.
Yes.
ಸೊ ಇಲ್ಲಿ ನಾವು ವೇದನ ಮಾಡಬೇಕಾದ್ರೆ ಯಾವುದೇ ರೀತಿಯಂಥ ಯಂತ್ರಣನೂ ಮಾಡೋದಿಲ್ಲ.
Huh.
ಮತ್ತೆ ಅದ್ರ
ವ್ಯದನ ಅಂದ್ರೆ ವಿ ಆರ್ ಪ್ರಿಕ್ಕಿಂಗ್ ದ ಮೈನ್ಯೂಟ್ ಸಿರಸ್ ಅಷ್ಟೇ. ಸೊ ಅಲ್ಲಿ ಯಂತ್ರಣ ಅಂತ ಮಾಡಲಿಕ್ಕೆ ಅವಶ್ಯಕತೆನೇ ಇಲ್ಲ. ಸಿ ದಟ್ಸ್ ವಾಟ್ ಐ ಟೋಲ್ಡ್, ಗಿವ್ ದ ಎಕ್ಸಾಂಪಲ್ ಆಫ್ ಬಸ್ತಿ. ಈಗ ನಿರೋಗ ಬಸ್ತಿದ ಅಮೌಂಟ್ ಈಸ್ ವೆರಿ ಹ್ಯೂಜ್, ಸಮ್ 300 to 400 ml ವಿ ಗಿವ್, ಬಟ್ ಸೇಮ್ ಅಮೌಂಟ್ ವಿ ಕಾಂಟ್ ಗಿವ್ ಇಟ್ ಇನ್ ಉತ್ತರ ಬಸ್ತಿ. Where the srotas is very minute, and based on that we have to give. So similarly, when you find Sira over there, you can take Sira, you can do Sira Mokshana over there, Rakta Mokshana over there. But sometimes in some conditions we can't find at all the Sira over, but we have to do, like they have told, we have to do here, Rakta Mokshana over here, or Vidva on that particular point. So that time we just prick on what basis they have told. Like I had a particular slide was there where I explained the vrihi pramana is equal to that of needle. So in that particular shloka they have told in mamsa pradesha you go half vrihi. If there is more of asti pradesha, you just do prachanna as that of kutarika shastra. So here and all it is like asti pradesha. So little bit of needle goes inside, you will get results. So that is the basic rule.
And the basic doubt is, this Viddha Karma, all the points, are we doing this exactly on the siras?
Siras, see,
Yantrana is required for sira.
Yes.
We have identified the sira.
exactly.
And for that, Yantrana is required.
Yes.
But all these points of Viddha Karma we discussed, are these really we are doing this Viddha Karma to the sira?
There might be minute siras below.
Yeah,
But sir, while doing yantrana on Urdhva Jatragata, he told some fist is keeping like this and one behind. Around. That position we can't do here, or is it not necessary for that?
What? I didn't get
One position told
That
is Sirautana.
Utthana for those particular siras.
Siras.
Yes.
Sir.
But we are not doing Viddha directly to on those siras here in this.
Like if, sir, if we find siras in that particular position, we can do. Like in certain cases, they usually in Ardha Bhedaka Surya Varta, they go for directly jugular vein. But thing is that is more risky. You should be well trained to find the jugular vein, to puncture the jugular vein, and you should know how to hold the tourniquet.
Yes. Yes.
Better than that is this is what we feel. And they have told, like if at all we are not able to elicit the siras over there, apart from that marma, you do the vedana karma. And how much insertion of needle should be there is based on that shloka. In Mamsa Pradesha Ardhavrihi, in some Asti Pradesha like Kutarika Vatta, how we do Prachanna Karma, Kutarika Shastra Inda. So like that we have to do. That is the basic rule they have told.
Okay, thank you.
Anyone else?
Sir, you mentioned that apart from the...
Introduce yourself.
Namaste, sir. I am Dr. Sameera Simha. I am from Bangalore. I just finished my BAMS, stepping into MD.
Okay.
You told that there are many anukta vyadhis for which we can do Viddha karma and Agni karma. Could you please demonstrate with an example as to how we use the principles that are told in the Shastra to apply it in anukta vyadhi? Probably one example can help us, develop our own.
Okay. So now when we see, suppose autism, what are the signs and symptoms?
There is clear mental retardation.
Yes.
There is
Patient is not, he
is
will
not oriented.
simply behave like how he wants. So that particular specific term or specific signs and symptoms are not explained as such, but they have told apasmara.
Unmada and apasmara.
Unmada and apasmara.
That is fine, sir. But
Yes.
My question was more towards a hridroga, for example.
Yes.
Or Janusandhi Sula, you have told.
Okay.
Or a kidney stone, you only quoted. So how do we develop, say, okay, take an example of hridroga or kidney stone. How do we go about finding out the point?
See, Hridroga, again, later stage we can control. First stage, usually our sir used to tell Pottali Kalpanas will give more result. You know Pottali Karma. Usually, I guess, Hemagarbha Pottali. Where you take 7 rounds of that Pottali Karma, coin shape, and ask the patient to lick. And there, more of the Basti Karma will include. Post that, we can control with Viddha Karma. Everything we can't go. Certain anukta vyadhis, like suppose we see retinitis pigmentosa, where there is a loss of vision. So we can take in which patalagata we can put it, and accordingly we can treat which dosha is hampered over there. How did it come to that particular patient? Based on that we can treat.
And just on writer side, I think first in Ukta Vyadhis we will start doing this.
Agreed, sir, agreed.
Then we will think of Anukta Vyadhis when and how to do it.
One more I'll like to tell. Last presentation I had shown one wrist drop case. Yes, wrist drop means what is there actually there? Should we take Vishwachi? Should we take what? Wrist drop is explained in our classics directly. Okay, Khanja Pangu for legs they have told, but wrist drop? Only wrist drop is there. Paksha, not whole limb, it is not affect, only wrist drop. So there we have to see what is the Nidana. So what that case was, he by profession he was a photographer. So in the daytime he used to go for functions for clicking photos. Night time he used to edit those. So in that particular month he had a hectic schedule, and the night he used to drink also. And again after that, just before he got that signs and symptoms, just one day prior, like on that day there was a function at his home. So one day prior he did heavy work, like lifting weights, pushing furniture here and there, getting groceries and all related to Vata Rakta. So directly mentioning of that disease is not there. And Vishwachi I took because there was slight radiating pain from shoulder till elbow. So I took Vishwachi. and it got cured within 2 weeks. It's like that we should see. We should take the history.
Namaste sir, I'm Visharda, intern in GMC Mysore. So my doubt is purely based on observational basis. Like we have seen few practitioners do Viddha Karma where they pierce it more than Ardha Vrihi Pramana and they twist it a little. They let it be there like for 2 seconds and all. So what is the right method to do Viddha Karma?
Never twist. That is done in acupuncture. They insert the needle, they twist, they give some certain stimulations also through that needle. But in Viddha Karma it is not like that. Even according to Shastras, we don't do Viddha Agni together. But some people do. They get result, that is secondary. But according to Shastra it is not there. Just prick, remove it. That's all.
Also sir, I have one more doubt. Like when we do Viddha Karma in Jivha Mula, you said that all the Jivha related or Danta related Vyadhis it can be done. So if we take dental caries, can we treat that with it because dental caries?
Dental caries pain we can treat. Caries we can't. Yes, depositions, all that blackish deposition we can do Agni Karma with beeswax. Keep the beeswax, small beeswax in that particular cavity. Heat the Swarna Shalaka or whatever Shalaka which can go easily in the mouth without touching the oral cavity. And just melt that wax in that particular cavity. So after some time that wax will come out with all the dirt or something, all the remains from that particular. And after every such sitting should be done repeatedly for 3-4 days or 1 week. And patient should tell that pain is coming down. And then after, if you have that much of confidence, fill that cavity with laksha. Same procedure. Heat it and put it in the cavity. That is so strong that even the dentist instruments will fail in that if we want to take it out. So strong it is. Once patient was there, sir did filling of and everything, but suddenly something nidana he took and the pain shoot up again. So he went to the sir, referred to the dentist, and dentist was trying to remove that filling. 1-2 instruments broke only there. So hard it is. Then sir only told, heat a rod, put it and just pull it. It came out.
Sir, like usually in caries the enamel is corroded, right? So the nerve endings are exposed. So that means the patient has a lot of pain. If we put beeswax there and use a shalaka, do we need local or can we just do it directly?
Directly.
It
will not come. When we do Jivha Mula, pain will come down.
So first Jivha Mula and then followed by Agni Karma.
Even you can do on the Danta Mamsa, gums of that respective Danta. Just prick on the Danta Mamsa. You should keep it in that cavity and hot rod we should insert. It looks dangerous. Just to melt that we should put a hot rod inside. That's all. With proper care. ಆಚೆ ಈಚೆ ತಾಗಬಾರ್ದು. ಇಲ್ಲ ಅಲ್ಲಿ ಫಿಲ್ಲಿಂಗ್ ಥರನೇ, ಪರ್ಮನೆಂಟ್ ಫಿಲ್ಲಿಂಗ್ ಥರನೇ. That strong. Our fillings and all, it will come out. Even the cap will come out somewhere. But Laksha won't. It will stick to that cavity so hard that the tooth will break, but Laksha will not break. That's all.
Just a question. What is the source of Laksha? I don't know. How do we?
That is, some people say animal excretion.
What have you used?
I have not personally used. Huh?
What has
Like whatever we get in market.
ಮಾರ್ಕೆಟಲ್ಲಿ ಏನು ಸಿಗುತ್ತೋ
ಅಷ್ಟೇ.
ಏನು ತಂದು ಕೊಡ್ತಾರೆ ಅದನ್ನು ಯೂಸ್ ಮಾಡಿದ್ದಾರೆ.
ಅದೇನೆ.
ದ್ರವ್ಯಗುಣ ರಸಶಾಸ್ತ್ರದವರ ಹತ್ರ
Please contact them.
Yes, next.
Namaste sir, myself Dr. Mallika, PG scholar from GMC Mysore. So my question is, you have explained
in which and all conditions we can do Viddha karma and how to do. But what are the limitations, or is there any contraindications for Viddha karma except ama? You have explained that.
Yes, like in few cases, good question. You should know where not to do Viddha karma again. In few online lectures, previous online lectures, sir had got a cases where there was a hamper of blood supply, or what is that called? In smoking, people who smoke, they will have Berger syndromes and all those things. So such cases had come to sir. One though below the knee there was no completely circulation blocked. So there it will not work only. How much ever it will. Such cases. Extreme cases where there is more of sepsis, there Viddha karma will not work. Wound where is more of sepsis. In last stage, yes, initially stage I had shown in previous this thing, it worked. But sepsis agiro conditionally we should not purposefully go and worsen the condition. It will come to you. It will damage your own knowledge of Viddha karma. It will damage the trust. Better tell you go higher centers. If they are telling to ampute, ampute. And certain surgical conditions like we saw kidney stones we can cure, but certain size, largest stone sir had cured, it was 1.4 centimeter, largest. Patient came with that stone next day, but I feel like after 1.5 centimeters you should not touch. Better give some medicine which can digest the stone either, or if there is so much of pain, opt for the surgery and remove the stone. Post surgical you can manage. Post surgical you will have some symptoms in those patients. Gulmavat symptoms you will have, Vata Raktavat symptoms you will have. That you can manage with proper post-op instructions to that patient, proper post-op diet. If he is not following, he will have those symptoms, and you can treat that.
Namaste sir, I am Vaishnavi from GMC Mysore. Sir, is there any chance we can do Viddha karma in diabetes and hypertension?
Nidana. See, I'll tell you. I explained diabetes case last time also. There were 2 diabetic cases in sir's clinic. One he was treating since I guess 6 months or 1 year, but still his diabetes was not coming down. Every visit sir used to ask how did it start, I need it. One fine day he told, sir मुझे कुत्ता काटा था, कुत्ता काटने के बाद 1 महीने बाद मुझे डायबिटीज डिटेक्ट हुआ. So sir suddenly changed his treatment to Visha Chikitsa, dog bite. He included Dhatura Kalpa in his treatment. Immediately sugar level came down. Similarly, one more case I told, a small kid, 14-year-old kid, 14-year-old kid, suddenly raise in sugar, 300, 400 sugar levels. Why? After 1 month of treating, his relative told that he was very attached to his elder sister. She slipped in the bathroom, she fell, she got hurt on head and she on the spot died. After that he is mentally very dull. So there Manasika Viddha karmas were used. So again, diabetes means no. This particular point, no. See the nidanas. Similarly, in infertility also, see the nidanas. Many of the infertility cases will be mentally unstable. They will be in anxiety. Similarly, in Kushtha, they will be always thinking about their skin, about their appearance. Their doing Kshipra and all other things will not work, and you should do Manasika Viddha. You can see in Kushta Chikitsa there is an involvement of Vacha, Jatamamsi, such drugs also. Why? Because it has affected Manas also. It has affected Manas. So based on what Nidana it is, you can do. Some people will have tension, like tension related diabetes. So much of work, office kelsa, adu kelsa, idu kelsa, ella tagondu, they will get diabetes. There just bruma they will take it down along with medicine. So you have to just see what is the nidana, what is the probable samprapti, and accordingly treat.
Snoring, is there any point, sir?
Snoring, again we have to see whether it is kaphaja or whether it is due to obese. Usually we take Nasagra, Upanasika.
Sir, as beginners of practitioners of Viddha, what kind of mistakes may we be doing, and how do we avoid them, and what is your advice?
One thing, best advice is go to a trained physician who is doing Viddha Karma, Agni Karma in practice. Go there, be there with them, learn and come.
Address is here.
Not this one. Best is in Pune, not this. Best is in Pune. If you are lucky enough to go there, go. Without a second thought, you go. Because in a day, 500 patients in a small clinic, 12 to 12 OPD, 12 hours OPD. No other clinic I feel you will get. Minimum 500 patients. Apart from that, on every Wednesday there is a camp. There minimum of 200-250 patients will be there. If you are lucky enough, you can go to Sir's home in Nanded. He takes two of the students, he takes from Pune and he takes there. So in 2 days, minimum of 800 patients. Starting from morning 7 o'clock till night 1 o'clock. Next day, starting again at 7 o'clock till the bus comes to his door. Like if this is the room, Sir's house, the main road, that what is there, that is the bus stop. Till the bus come to his door, he will see the patient. That is the dedication what Sir is giving. He enjoys. When I had gone to his home, it was World Cup final. Still patients were there, 800 patients on those 2 days. We slept around 3 o'clock, woke up around 5:30 because patients will come to number haklikke bartare. Sir, my name you put first. They come from 5:30. Though sir will get up and start from 7 o'clock, they come 5:30. There is one hall where we all sleep. Patient will come sit beside us. We will be shamelessly sleeping there. Because we are sleeping so late, 3 o'clock. So if you get chance, leave everything aside, go, run. If not, catch hold some Sir students who are practicing well and learn from them. But still, if you want to practice without going to them also, ask who knows, who has at least little bit of knowledge. Okay, this is the point, is it right or is it wrong? Yes, you will take some time, but you ask it. I am not telling you will be completely expert in 1 or 2 weeks, because I was only in trauma 2 weeks. What is happening? 500 patients I have never seen in any clinic, in any hospital for that matter. Patients are coming. We are standing from morning till night. We get gap of 2 hours, 8 to 10. But sir, he goes there to his Sir's clinic in Pune main city. He sees 150 to 200 patients there in 2 hours. His dinner in Gadi. Think that level of dedication when you see, you will ಹ್ಯಾವ್ ದ್ಯಾಟ್ ಫೈರ್. ನಾನು ಕೂಡ ಮಾಡ್ತೀನಿ. ವಾಟ್ ಎವರ್ ಇಟ್ ಈಸ್, ಐ ವಿಲ್ ಡೂ ಪ್ರಾಕ್ಟೀಸ್, ಆಯುರ್ವೇದ ಪ್ರಾಕ್ಟೀಸ್ ಓನ್ಲಿ. ಎಸ್, ಯು ಶುಡ್ ನೋ ವೆನ್ ಯು ಶುಡ್ ರೆಫರ್ ಟು ಮಾಡರ್ನ್ allopathic doctors. Once they treat, tell the patient, after that we can treat better. But emergency ge adu beku. You go fast if you want him to survive. That you should know. Ha, ಗುಡ ಇದ್ರೆ ಮಾಡಿ, ಅಥವಾ ಏನು ಕ್ಲಿಯರ್ ಚಾಕ್ಲೇಟ್ ಮಾಡಬೇಕು. ಅಷ್ಟು ಹೆಲ್ಪ್ ಆಗೋದಿಲ್ಲ, ಮಾಡ್ಬೋದು ಟ್ರೈ, ಬಟ್ ಗುಡದಿಂದ ಬೆಟರ್.
ಅಗ್ನಿಕರ್ಮ ಮಾಡೋದು ಒಳ್ಳೆಯದು, ಅದಕ್ಕೆ ಕೂಡ ಏನಾದರೂ ಆಮೇಲೆ ಸಪ್ರೇಟಾಗಿ ಮಾಡೋಣ.
ಇಲ್ಲಾಂದರೆ ಈಗ ಯಾರ ಹತ್ರ ಕಿಲ್ಲರ್ಸ್ ಚಾಕ್ಲೇಟ್ ಇದ್ದರೆ ಎಲ್ಲ ಮಾಡ್ಬೋದು.
ಅವ್ರಿಗೆ ಎಲ್ಲ ತರಕ್ಕೆ
ಹಾಂ,
ತರಕ್ಕೆ ಇಲ್ಲ
ಅವರಿಗೆ
ಕೆಳಗಡೆ ಅಂಗಡಿ ಎಲ್ಲ
ಬೆಲ್ಲ
ನಿಲ್ಲಿಸೋಣ, ಫೀಡ್ಬ್ಯಾಕ್ ತೊಗೋತೀನಿ. ಅಷ್ಟೊತ್ತಿಗೆ ಇದಾಗಿ ಬಿಡುತ್ತೆ. So now it's time to listen to the feedback. So if anyone from the audience can give your valuable inputs about today's program or suggestions for future programs, you can give. Go on. Yeah, please. Whenever coming. Please introduce yourself and then.
Namaste sir, I'm Viddha Agni. I just started my clinic 6 months back. I'm from Chennai. I just wanted to say one thing. I came the last class also. There was zero confidence. I saw all of this. I said, okay, this person is getting result. We will see later, maybe after a few months of attending class. My mother has Vata Kantaka and she also has Vata Rakta. She's had it for a long time. We have done a lot of internal treatment and it's been going on for like 2-3 years. The pain keeps coming and it flares a lot. She can't walk. There's a lot of problem. So I said, okay, at least Kshipra, this much confidence I got, let me start with that. I did only for the first day. I didn't remember to ask how you're feeling all that. Next day she came at the same time and said, can you put again? It's like, oh, okay, so actually speaking. So in 10 days I had been doing the sittings and she is a yoga teacher also. So there was an issue, she couldn't even do her practices. In a week's time she's been able to go back, do all of her asanas, do the entire class schedule. So I wanted to say that it has been very inspiring to note that it's possible to do within this much time. So thank you for the input.
Thank Ayurveda, not me. See, that comes when you have that confidence. If you didn't have that freaking confidence only, it wouldn't have come. So be confident, whatever you are doing, be confident. Treat with a positive attitude. Treat any patient with a positive attitude. Whether you fail or pass, that is secondary, but positive attitude should be there.
Anyone else? Chili.
Hello sir, again I'm Vaishnavi from GMC Mysore. Like last time session ನಿಮ್ಮದು ಅಟೆಂಡ್ ಮಾಡಿದ್ಮೇಲೆ ಇನಿಷಿಯಲಿ ಸ್ವಲ್ಪ ದಿನ ಏನೂ ಮಾಡಲೇ ಇಲ್ಲ, ಆಗುತ್ತಾ ಇಲ್ಲ ಅಂತ. ಆಮೇಲೆ ಓಕೆ ಟ್ರೈ ಮಾಡೋಣ ಅಂತ ಅದೇ ಜಾನು ಸಂಧಿಗತ ವಾತದಲ್ಲಿ ಟ್ರೈ ಮಾಡಿದೆ. ಒನ್ ಪೇಷಂಟ್ ಹಿ ವಾಸ್ ಆನ್ ಡಯಾಲಿಸಿಸ್ ಆ್ಯಂಡ್ ಶೋಥ ಥರನೂ ಇತ್ತು. ಈವನ್ ಜಾನುಲಿ ಲೈಕ್ ಇನ್ಸ್ಪೆಕ್ಷನಲ್ಲೇ ನಮಗೆ ಕಾಣಿಸ್ತಾ ಇತ್ತು ಎಷ್ಟು ಶೋಥ ಇದೆ ಅಂತ. ಜಸ್ಟ್ 1 day ಸಿಟ್ಟಿಂಗ್ ಆಲ್ 6 points I took ಆ್ಯಂಡ್ ಹಿ ವಾಸ್ ಟೇಕಿಂಗ್ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ಆಲ್ಸೋ. ಹಿ ವಾಸ್ ಟೇಕಿಂಗ್ ಎವ್ರಿ ಡೇ ಫಾರ್ ದಟ್ ಪೇನ್. ಜಸ್ಟ್ 1 day ಹಿ ಕೇಮ್ ನೆಕ್ಸ್ಟ್ ಡೇ ಆ್ಯಂಡ್ ಇನ್ಸ್ಪೆಕ್ಷನಲ್ಲೇ ಅದು ಶೋಥ ಕೂಡ ಕಡಿಮೆ ಆಗಿತ್ತು. ಐ ವಾಸ್ ಲೈಕ್ ಶಾಕ್ಡ್. ಅವರು ಹೇಳ್ತಿದ್ರು ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ಇಲ್ಲದೆ ನಾನು ಯಾವತ್ತೂ ಇಲ್ಲ, ಲೈಕ್ ಆಲ್ಟರ್ನೇಟ್ ಡೇ ಒಂದು ಡೇ ಬಿಟ್ಟು ಬಂದಿದ್ದರು. ಹಿಂದಿನ ದಿನ ನಾನು ಪೇಯ್ನ್ ಕಿಲ್ಲರು ಕೂಡ ತೊಗೊಂಡಿಲ್ಲ, ಹಾಗೆ ಪೇಯ್ನ್ ಕಡಿಮೆ ಆಗಿದೆ ಅಂತ ಅವ್ರು 3 ಮೆಂಬರ್ಸ್ನ ಮತ್ತೆ ಕರ್ಕೊಂಡು ಬಂದಿದ್ರು ಜಸ್ಟ್ ಬೈ 1 ಡೇ. ಸೊ ಜಾನಸಂಧಿಗತ ವಾತದಲ್ಲಿ ತುಂಬ ಮಾಡಿದ್ವಿ ಸರ್. ಆ್ಯಂಡ್ ಗುದ್ರೆಸಿರಿನೂ ಅಷ್ಟೇ, ವಿ ಆರ್ ಡೂಯಿಂಗ್ ಇಟ್.
Along with that, take Shotha point also.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಹಲೋ ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಫಸ್ಟು ಅದೇ ನಾನು ಲಾಸ್ಟ್ ಇದು ಮೈಸೆಲ್ಫ್ ಡಾಕ್ಟರ್ ಸಚಿನ್ ಬುಸಾರೆ, ಆ್ಯಸ್ ಮೆನ್ಷನ್ಡ್ ಇನ್ ದ ಮಾರ್ನಿಂಗ್. ಐ ಆಮ್ ಅ PG ಸ್ಕಾಲರ್ ಇನ್ ಶಾಲಕ್ಯ ತಂತ್ರ ಫ್ರಮ್ JSS Ayurveda Medical College. I have taken a synopsis like a dissertation to work on Viddha Karma, how it works in Karnana, the subject to tinnitus. Usually so many of people are not working on Viddha Karma. I am the second person in RGHS who took the synopsis work on Viddha Karma. Basically, before I didn't know any knowledge. By referring this book of Surf book, I got to know so many knowledge about it, but I never seen directly like how we can do and all. By the knowledge of this and videos of Chandrasekhar sir, I have practicing now in my hospital, which is in JSS hospital. I am getting results. Like I am taking alternate settings of Viddha Karma on first day, third day, fifth day and seventh day, along with Nasya of Balatailya. I am getting result, but follow-up I have taken like 15 to 20 days to see whether it recurrent condition is more when compared to before and all. I have taken the review of the patient also. Patient have said like for the first setting only they have reduced the ringing sound. Usually they used to get continuous sound throughout the day. When there is any loud voice or something, they should not recognize that sound. But in the silent area and all, they used to get very much irritated. Most of the patients also cried in front of me. Like in the modern medication, don't have any such treatment. They will give tinnitus markers and all. You should live with that. But for the Viddha Karma only, they are getting so many patients also. Before, no one also was doing in a hospital. Through I am doing, we are getting so many patients in Salakya Tantra. And one thing sir, and I was having little bit doubt like for how many seconds or for minutes we have to do Viddha Karma. For tinnitus case, I am giving like 5 seconds and also. Last recent case I have taken for a glaucoma, where I have done for 2 minutes sir. Like
Not necessary. Just prick it and take it off.
but for after doing for 2 minutes I have got so many results sir. Before he was having tarpana and also he was not having so much relief from that. For just Viddha Karma only he has got
So many
reduced in the
results.
symptoms sir.
Just prick it and leave it and see how the results you will get. Because this glaucoma, even Gokte sir used to have. He had glaucoma. He used to do Viddha every day and he used to manage. So it's not necessary to keep it. If at all you feel that more of Rakta is coming out, you can keep. But if there is no at all Rakta coming out from there, no need. And if Rakta wants to come, it will come anyhow. So no need of keeping needle over there.
Can we standardize sir, like for everything they will ask for standardization of such things sir. For Viddha Karma, can we standardize like particular settings for particular disease?
See, again, the severity of the disease matters over there. It's not like what we think in Ayurveda is not as that of modern. Each and every, though the disease is same, but each and every has its own different origin. As I told, like one might get aghata, one might have more of earphone usage, or one might have because of cold breeze and all. So everywhere the severity is different. Yes, so because of that we see as every disease as Purusham Viksha according to Ayurveda. We can try standardizing it, but somewhere I feel we can't, because every disease, every condition we treat is matters. See, even when Basti we would have told for 7 days only, or 15 days only, or 30 days only. One set of Basti only we would have told for all Vatarakta. Why 3 different sets? Yes, so one, like how severe it is, based on that we should see. So try doing, if you can, it's best. But what I feel, I have told you, I have tried to convey. Because again, like so based on what you like, because again everything is different. So based on that, it will be bit difficult, I feel. I don't know. So that's what I can tell. If you can try.
Actually, I thought of standardizing only, sir, but the college review committee and all, they, because the lifetime, the span will be less.
3 years.
Yes,
In
sir.
3 years you can't do anything actually. You later you can standardize. Work on it, standardize. Try it. But I don't know how much it will be successful. Because each and every patient when we see, it's something new. Is what I feel. Okay.
Thank you, sir.
Okay, now we are, anyone else? Okay, now we are concluding today's session, and today's last session will be by giving a demo of Agni Karma only. We have a frozen shoulder case, so the sir will do one Agni Karma to that frozen shoulder case. And with that, we will wind up today's session.
Book is main shloka is that only, the huge shloka. So that book you can order through Vaidya Gopte Memorial Foundation. You can contact me anytime. Just message me first, then call. Don't call anytime. Just message me first. Okay?
One more thing, I think many of you do not know. Rohit is also a very good artist. ನೋಡಿದ್ದೀರಲ್ವಾ
ಅವರ ಗುರುಗಳದ್ದು ಬಹುಶಃ ಅವರ ಬರ್ಡೇಗೆ ಅನ್ಸುತ್ತೆ ಅವ್ರದ್ದು ಗುರುಗಳದ್ದೊಂದು ಸ್ಕೆಚ್ ಮಾಡಿ ಕೊಟ್ಟಿದ್ದನ್ನು ನಾವೆಲ್ಲರೂ ನೋಡಿದ್ದೀವಿ.
Farewell, sir.
Okay, so and not only that, they also prepare lots of medicines. They also prepare lots of medicines, and Rohit is also preparing many medicines. He himself collects the raw drugs and authentically he prepares the medicines. And last time itself, I got Shatavari Kalpa. I told him to bring some Shatavari Kalpa to me also, and really it was very effective, genuinely prepared. So whole day he is busy in either practicing, if not practicing, then preparing the medicines, collecting the medicines, etc. So once again, wholeheartedly, thank you, sir, for being with us, for coming from all the way to Udupi till here and enlightening us about Viddha Karma. Just before felicitating our guest, we have few announcements. As you all know, Visanda, one group of 10 doctors, 10 enthusiastic doctors, they conduct one program called Pragalbhyam every month, and tomorrow also there is one program here only, in this venue only. It is just 2.5 hours program from afternoon 2:30 to 5 o'clock. And tomorrow it will be completely focused on the Shirashula, the various types of Shirashula and its management. The program is little different from, it's not just like a seminar, it will be totally activity based program. There will be a demo of how to take history, a real case. They will be enacting how to extract the history from the patient. Then after that, understanding the samprapti of the various types of Shirashula, how to understand the Shirashula in Ayurvedic perspective and various angles of Shirashula and the line of treatment.